Thank you for the opportunity to speak today. So I'm going to be talking about patient-reported outcomes and using hand surgery as kind of a case study. So back in the 90s, up until actually pretty recently, patient outcomes were pretty much just assessed with sort of what we can measure from the patient, range of motion, grip strength, pinch strength. But there's been a shift in the 2000s to kind of patient-centered care and patient-reported outcomes. And there's so many out there that exist. Quick Dash, Promise, which was actually created by the NIH, Boston Carpal Tunnel Score. And most of these were actually made in the Western world and now is used kind of as baseline to assess patient outcomes after surgery for routine clinical care and as a benchmark for most studies. Pretty much any hand surgery paper that you put out that's related to patient care, some sort of PROMS has to be used. However, since they're made in the Western world, this made me wonder, is this actually capitulated internationally? Are these PROMS capturing the goals of patients outside of the United States, Canada, and the Western world? So we performed a multi-center study looking at the USA, Austria, France, Qatar, and Taiwan. We looked at 50 patients from each clinical site who had either trigger finger or carpal tunnel. And then we used one type of PROMS, the patient-specific functional scale, but this PROMS is actually very open-ended, pretty much just asks 3 questions. What are your 3 most important goals? And to rank them 1 through 3. I performed a template analysis or a qualitative analysis, which was initially performed by King et al., where you employ a priori themes, which I found from the hand surgery literature. And then I coded everything the old-fashioned way using stickies. I had to step away from the computer, which was challenging. And then this was a very iterative process. To further contextualize these results, I used the ICF, the International Classification of Functioning, Disability, and Health, to explore these cross-cultural differences in greater detail. We had 225 participants, 157 women. The mean age was 62 years old, and the majority of patients had carpal tunnel, though we did have 91 diagnosed with trigger finger. So looking at the ICF, you can see that there is great variation in the themes overall desired by each specific country. A more kind of granular approach, every country reported that household chores were important to them, but the type of household chores were very different. For example, in France, cleaning dishes, pretty much like 70% of patients wanted to be able to clean dishes, but this was not true in the United States. The fork versus the chopstick. Patients in Taiwan mentioned the use of knife and chopsticks, whereas in the United States and France mentioned the use of wanting to be able to use a fork or a knife. So these are 2 very different kind of hand motions that are needed. Mode of transportation also varied by country. In biking and motorcycling was mentioned repeatedly in Taiwan, but in the United States, driving was pretty much the most common one. Praying was listed only in Qatar, and 70% of patients listed praying as being one of their most important goals. In Austria, it was the only country that wanted to read. I don't know why. All countries were interested in writing and typing and computer work, but the sort of like specifics within that did vary a little bit. So kind of seeing that these countries did have different granular results, I wondered, well, let's take a step and look at all of the PROMs that I kind of mentioned before and see if they're actually being captured. And I looked at the number of missing items. And you can see that the circles are much bigger outside of the United States. So we're missing something. Things can also be lost in translation. For example, a study out of India wanted to use the patient-rated wrist evaluation score, and they changed or translated, grabbing a doorknob and turning a doorknob to turning a key. These are 2 very different hand motions, grab and grip versus key pinch. This study does obviously have limitations in the fact that it is a qualitative study and we only had 50 patients from each country, but it does show that there is a diverse set of patient priorities and functional impacts across countries. And there is definitely a bias in our current tools that we use. There might be in the future, with all this advent of AI and the cool studies that we're hearing about, possibility to kind of look at a more open-ended response and analyze it that way. And there will be a continued evolution of PROMs, but for now, I would say that the patient-specific functional scale at least is a step in the right direction. I'd like to thank Dr. Curtin and Dr. Hill for all of their help. This was my first qualitative study ever, and all of the countries that helped participate in our project. Thank you.